What's going on, everybody? Dr. Lou Roz here at Stonecast Chiropractic Clinic, and today I'm going to show you a little bit of what I do as a chiropractor when I'm doing chiropractic spinal manipulation. Now, my assistant today, Katie, is going to be assisting as the body for me to be able to show you some of these chiropractic adjustments. And chiropractic adjustments are very useful because what they do is they help with those discs that may be suffering from an injury. There's also the ability for their just joint restriction. And so there's a lot of things that go into spinal manipulation as far as the benefits. In a traumatic situation, of course, increasing blood flow to the surrounding soft tissues, muscles, tendons, ligaments, but the discs themselves don't have direct blood supply. However, with motion, they do get a little bit more of what's called imbibition, which is a process by which they rehydrate and they can move a little bit better. So that is the point of doing a spinal manipulation, or an adjustment as we call it. So without further ado, let's go ahead and get started. So Katie, all I need for you to do is just lay down, face down. And there are several methods. I'm just going to be doing basic diversified, but there are several methods of doing spinal manipulation, and we're going to do diversified. Okay, so first things first, I kind of already know Katie, so I don't have to do that much of an assessment. We're just going to get straight to adjustments. But basically, a chiro will assess the entire body. Some of the things that we do sometimes is leg length check, make sure that the hips are in alignment, and of course, palpation, which would be touching the patient's spinal segments and seeing if something feels restricted or the patient says, ouch. So right now, this is just a basic scan. This is static, basically just feeling for any deviations of the spine. And then we go into motion. We actually put a little pressure into the joints, feeling for any joint restrictions again. Katie, how we doing?
Good.
Okay. All right, so just by this basic assessment, I can already tell that she deviates just a little bit here. Okay, so we're gonna go right there. Okay, breathe in and out. Okay. In and out. Good. Okay, now we're going to go up to the lower cervicals, upper thoracic. Okay, this way. Hans is taking up my space there. Oh, that's Hans, just in case. Just some mobilization. I'm going to crack out of that one. Okay. All right. Okay. Now for the lower spine, we're going to place the patient sideways, side posture position. So go ahead and lay down sideways, like if you were going to sleep on your side, and I'll guide you to the rest. Okay. All right. So he's already trained, so she kind of already knows, but I like to tell the patient, so what you can do is keep your bottom leg straight, bend the top one, and I always let them know I'm going to contact you with my forearm, kind of along your low back towards your bum, and that's in order so that the patient understands exactly what I'm doing when I'm doing it. Okay, so then I take out the shoulder, patient's arm, stabilize them. Okay, I'm going to reach over and bring you closer towards me. Okay, so I'm going to reach just above your waist. Okay, and as I do this, you can feel that your lower back is starting to open up. Use my contact point. Okay, here, and all right, here, next side. All right. And move closer this way. Here we go. Okay. That was the restricted one. The other one was kind of like, no problem. All right, great. Straight. All right, so we finish off with the cervical spine. Now there's many different ways to do this. In Katie's situation, I'm going to do a sitting rotary move. And so all I do is have the patient look down a little bit, and I'm palpating along the cervical spine. I can already tell around C4, 5, move it. So now I'll go this way. Okay, and then maybe not. Okay. So today Katie was better on one side than the other, so sometimes you don't always get the pops. And by the way, those are called cavitations. They're not always necessary in order to get the benefit of a spinal manipulation, although we always feel better when we hear them and we feel them. But if it's not broke, don't fix it, right? So we like to make sure that the joint is moving the way it is. We did do motion into the left side, but that seemed okay. Then we went to the other side, definitely had joint restrictions. So we adjusted that side, and it's always about adjusting those joints that actually need it. And that's one of the things to take away with chiropractic spinal manipulation. It's not about forcing anything, it's about gently moving the spine into the positions where it's supposed to be moving in a nice, natural way. That said, that is my video on spinal manipulation. Thank you all again. Stonecast Chiropractic Clinic, baby. And remember, don't just call any clinic. You
call a doctor.
That's it.